Should I consider Pellevé? I had a lower blepharoplasty done in 2014 and wasn't pleased with the results. I just want tight, normal-looking under eyes. I'm only 23, in great shape with a healthy diet, and I feel like I have always looked old because of these bags. They're hereditary, and I hate seeing them every day.
Thank you for your question. You submitted your question with several photos, and you stated in your question that you're 23 years old, you underwent a lower eyelid blepharoplasty in 2014, and that you weren't satisfied with the results. And you're asking, should Pellevé be done for you because your goal is to have tighter, normal-looking skin, and that you described that this area under your eyes is the result of a hereditary feature, and so you want to know if Pellevé makes sense. Well, I can certainly share with you my perspective just based on your photos alone and how I incorporate Pellevé and other modalities to help rejuvenate people's under-eye area. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping achieve rejuvenation of the under-eye area is a core part of my practice. Everything from procedures such as lower eyelid blepharoplasty, as well as the use of injectable fillers, as well as lasers and radiofrequency devices to help improve this area. And so I think that it is important to make a distinction here and what you would expect from the Pellevé procedure. Now, first and most importantly, it has to be determined when you're looking up whether that shape, that little crescent shape under your eyes, is representative of fat or whether it's just an anatomical, essentially a shadow of the underlying structure, as well as what is the relative volume under the eyes relative to the cheeks. The reason I say this is that it is straightforward if there is any residual fat that would need to be addressed. Generally speaking, in the central area of the under eye area, there is usually not that much residual fat after lower eyelid blepharoplasty, but that's something that can be determined during physical examination. It's important to make that distinction because even if you try to tighten the skin, which is what you're trying to consider with the Pellevé device, you aren't going to be able to push the fat back. It's very important to understand fat pockets are fairly have a significant amount of volume, and they will not just shrink back because you tighten the skin. Now, as far as the role of a radiofrequency device in your situation, I think that given you are as young as you are, I would doubt that there would be a significant benefit. Generally speaking, radiofrequency devices and laser devices are more appropriate when we're dealing with a lot of the challenges that occur with progressive facial aging. Skin quality thins, collagen diminishes, and therefore thermal energy devices can be applied to help tighten the skin. Now, further, I would suggest you consider, since this is more of a genetic anatomic issue, there may be some value in exploring the appearance of the eyes relative to the cheekbones, but also to explore the idea of maybe using a filler, such as a hyaluronic acid filler, to help soften some of the areas where the under eye is hollow. There is always a balance that we try to achieve to get the optimal under eye appearance. Patients come who routinely have either the absence of under eye fat pockets or even minimal or mild under eye fat pockets with a relative deep hollow in the tear trough area. They do very well with an injectable filler such as Restylane. So I think that would be probably the next appropriate step in my mind for someone who wants to improve this appearance. It is important to understand that height does not mean youthful, and you're already very young. So you wonder how much room is there for skin improvement. Now, of course, I don't know if you're a smoker or if you have any other medical issues or allergies, but generally speaking, I tend to be more conservative when it comes to helping younger people. We have patients in your age group, particularly those and many who are performers, who are actors, and they're very sensitive about the way their eyes appear on camera. So certainly placing volume strategically probably would make more sense. In one of these photos, or at least one of them, you are made some facial expression, and if you're bothered by a fold of skin during facial expression, there's no technology that's going to diminish that significantly, because it's not just the activity of the muscle, but it's just the physical movement of the cheek upward that causes that skin to fold. It would be if you were to undergo go through a consultation with another physician other than the doctor who did your surgery, or to the same doctor, it would be good to review your photos and what you looked like beforehand, before the eyelid surgery and afterwards, and then get a sense of what is the true issue that can maybe be addressed with some type of filler or other modality. I think a lot of times people look at themselves very critically, and someone who's young can often be very, very critical, and that is something that is not unusual, but it's important to at least get some perspective. And so a lot of times what I'll do is I'll take pictures and I'll review them with the patient so that we can get a sense of what exactly is the main issue and what kind of outcome can we achieve with any intervention. Generally speaking, for a younger person, injectables usually is as much as I would typically do, unless there was a surgical indication, such as additional fat under the eyes. So meet with a qualified, experienced doctor who specializes in this area and learn about the options and take it from there. So I hope that was helpful. I wish you the best of luck. Thank you for your question.